You were given a medication to help you to manage your blood pressure, your blood sugar, your heart rhythm, your pain, and you trusted that because that is what you were supposed to do. You trust your doctor, you fill the prescription, and you take it faithfully every single day. But what if that very medication, the one meant to protect you, is quietly damaging your nerves? What if the tingling in your feet, the numbness in your hands, the burning that wakes you up at night is not a mystery condition with an unknown cause, but a direct and documented side effect of something sitting in your medicine cabinet right now? I am Dr. Ryan Mitchell, and today I am going to walk you through 6 categories of commonly prescribed medications that have been clinically linked to peripheral nerve damage, including one medication that is prescribed specifically to treat nerve pain, which research now shows can actually make the underlying nerve damage significantly worse. I will also share groundbreaking research published just a few months ago that every single person taking a common nerve pain drug absolutely needs to hear. Please stay with me through the entire video. The information at the end may be the most important thing you watch all year. And before we start, one critical reminder: never stop taking any prescribed medication without first speaking to your doctor. What I am sharing today is information to empower you, not instructions to act alone. Knowledge is your first line of protection. Here is something that puts this entire conversation into perspective. The United States fills more prescriptions per person than any other country in the world. In 2020 alone, 4.5 billion prescriptions were filled. And analysts project that number will reach 5 billion by 2030. More than 66% of American adults take at least one prescription medication daily. And for adults over 70, it is common to be managing anywhere between 9 and 13 different medications simultaneously. When you layer that many drugs on top of each other, the risk of what doctors call drug-disease interactions increases dramatically. That is when a medication prescribed for one condition triggers or worsens another condition entirely. And one of the most frequent and most overlooked consequences of this is peripheral neuropathy. Peripheral neuropathy is nerve damage that causes tingling, numbness, burning, or weakness, usually beginning in the feet and hands. More and more cases are being labeled as idiopathic, meaning the cause is unknown. But in many of those cases, the origin is not unknown at all. It is sitting right there in the patient's medication list. And once you understand which drugs carry this risk, you can have a very different conversation with your doctor about your symptoms. A clinical study of over 6,500 participants found that 69% of all medications carry between 10 and 100 documented side effects. Most prescribing physicians are only aware of 1 or 2 per drug. That gap in knowledge is exactly why this video exists. Let us go through the 6 drug categories. We will start with number 6, anticonvulsant or anti-seizure medications. For years, many physicians dismissed the idea that anti-seizure drugs could damage peripheral nerves. But in 2019, the International Journal of Neurology and Neurotherapy published research confirming clear links between several commonly prescribed anti-seizure medications and peripheral nerve damage. Medications in this category include phenytoin, phenobarbital, topamate, carbamazepine, sodium valproate, Kira, glucosamide, and gabapentin. Now, gabapentin, you may recognize that name because it is one of the most widely prescribed drugs for managing peripheral neuropathy pain. And here is the uncomfortable truth. The same medication millions of seniors are taking every day to control their neuropathy symptoms has been shown with prolonged use to potentially worsen the underlying nerve damage it is supposed to be treating. I will come back to gabapentin and its close relative Pabalin, sold as Lyca, with some truly alarming new research toward the end of this video. Please do not skip ahead. Number 5 on our list is HIV medications. Peripheral neuropathy is one of the most common neurological complications associated with HIV drug treatment, affecting both sensory and motor nerves, thoracic nerves, cranial nerves, and the autonomic nervous system. HIV medications linked to peripheral nerve damage include danosine, mistracytabine, stutine, Truvada, and azacitidine. If you or someone you love is managing HIV and experiencing nerve symptoms, it is worth having a specific conversation with your prescribing physician about whether the medication regimen may be contributing. Number 4 is immunosuppressant medications. Drugs used to manage autoimmune conditions like rheumatoid arthritis, lupus, psoriasis, Crohn's disease, ulcerative colitis, and multiple sclerosis. While these medications can be genuinely life-changing for the conditions they treat, several within this class have been shown to damage both the structure and the function of peripheral nerves. Medications in this category include Enbrel used for rheumatoid arthritis and psoriatic arthritis, Remade used for inflammatory bowel diseases, Humira used for inflammatory bowel disease, Arava used for rheumatoid arthritis, and Xeljanz used for rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and ulcerative colitis. If you are on any of these and experiencing new nerve symptoms, please raise it directly with your rheumatologist or specialist. Number 3 covers cardiovascular medications. And this is a broad and important category for many of you because heart and blood pressure medications are among the most commonly prescribed drugs for people over 60. The first in this group is Amiodarone, used to treat heart arrhythmias, irregular heart rhythms. Research has found that both the dose and the duration of Amiodarone use directly increase the risk of peripheral neuropathy. The higher the dose and the longer you are on it, the greater the risk of nerve damage developing. The second is Hydracine, a vasodilator used to treat high blood pressure. What makes this one particularly important to know is the timing. Hydrazine can begin damaging peripheral nerves as quickly as 3 weeks after starting it, though in some cases it may take up to 2 years before the damage becomes symptomatic. This means nerve damage can be progressing silently long before you feel it. The third subcategory is diuretics, commonly called water pills, prescribed to treat high blood pressure and reduce fluid retention, such as swelling in the ankles and legs. The mechanism of nerve damage here is indirect but significant. As diuretics eliminate excess fluid from the body, they simultaneously flush out essential minerals that your nerves depend on for healthy communication. The 4 most commonly depleted are calcium, magnesium, potassium, and zinc. When these mineral levels drop chronically, nerve function deteriorates. Commonly prescribed diuretics include hydrochloroid, chlorelidone, and phyamide, also known as Lasix. If you are taking any diuretic, please ask your doctor about taking a quality mineral supplement to replenish what is being lost. A link to recommended options is in the description below. If this is giving you information you have never heard before, please take a moment to like this video and subscribe so you never miss an update. We have the 2 most critical categories still to come, including the gabapentin research I mentioned at the start. Do not go anywhere. Number 2 is chemotherapy medications. With cancer rates rising across all age groups, chemotherapy-induced peripheral neuropathy, known as CIPN, has become an increasingly common and serious concern. It is well established that certain classes of chemotherapy drugs cause significant peripheral nerve damage, and some classes are far more destructive than others. Platinum-based chemotherapy drugs, including ciplatin, carboplatin, and oxaliplatin, which are widely used for lung, breast, ovarian, and colon cancers, cause peripheral neuropathy in approximately 90% of patients who receive them. That is not a small side effect. That is the expected outcome for almost everyone on this treatment. Taxane drugs, including docetaxel, pletaxel, and their combinations, cause moderate to severe peripheral neuropathy in between 57 and 83% of patients. Taxanes are commonly used for metastatic breast cancer, ovarian cancer, lung cancer, and certain blood vessel cancers. Vinca alkaloids, including vincristine, vinlastine, and vinorelbine, used for lymphas, acute leukemias, and solid tumors, carry a lower but still significant neuropathy incidence of around 30%. Now, here's something I want every person facing cancer treatment to know and to share with their oncologist. There is an amino acid called acetyl L-carnitine, sometimes abbreviated as ALCAR, that clinical research has shown can significantly reduce the risk of developing peripheral neuropathy during chemotherapy. Studies using 2,000 to 3,000 milliliters of acetyl L-carnitine during treatment found that it either prevented neuropathy entirely or reduced it to a very mild level. And crucially, it did not interfere with the effectiveness of the chemotherapy itself. In fact, it often helped indirectly, because oncologists sometimes have to slow down or pause chemotherapy when neuropathy becomes severe. Preventing the neuropathy keeps the treatment on track. This is clinically significant information that is not routinely discussed, and I encourage you to bring it to your care team. And number one on our list is oral diabetic medications, specifically metformin, also sold under the brand name Glucage. This is the most commonly prescribed oral medication for type 2 diabetes, and the majority of the 37 million Americans with diabetes are on it. But here's what most people on metformin have never been told. Research has confirmed that metformin consistently depletes vitamin B12 in the body, and your peripheral nerves are critically dependent on adequate B12 levels to maintain the myelin sheath, the protective coating around nerve fibers that allows them to function properly. When B12 drops, myelin breaks down, nerve signals deteriorate, and peripheral neuropathy develops or worsens. Metformin also raises levels of homocyan, an inflammatory compound that damages arterial walls, reduces blood flow and oxygen delivery to nerves, and directly intensifies nerve irritation and damage. The combination of low B12 and elevated homocyan is a clinically documented pathway to peripheral neuropathy. If you are taking metformin, whether or not you currently have neuropathy, please speak to your doctor about also taking methylcobalamin, which is the most bioavailable form of B12 specifically for nerve health. You should also consider vitamin B6 in the form of pyridoxal 5-phosphate and folate in the form of 5-MTHF to help keep homocyan levels under control. These are not optional extras for anyone on long-term metformin. They are protective necessities. Now, I promised you something important at the start of this video, and here it is. In September 2022, a peer-reviewed study was published in the journal Cardiovascular Diabetes. Researchers reviewed data from over 210,000 patients with diabetic neuropathy who had been treated with either gabapentin, pregabalin, or their brand name equivalents Neurontin and Leca. These are the two most widely prescribed medications in the world for managing peripheral neuropathy pain and symptoms. What they found was deeply concerning. Within 5 years of beginning these medications, there was a statistically significant increase in the number of patients who experienced heart attacks, strokes, heart failure, peripheral vascular disease, deep vein thrombosis, and pulmonary embolism. And these episodes were appearing in some patients in as little as 3 months after starting the drug. Let me be very clear about what this means. The two drugs most commonly prescribed to treat peripheral neuropathy may carry serious cardiovascular risks that your doctor has almost certainly not discussed with you and may not even be aware of given how recently this research was published. I am not telling you to stop your medication. I am telling you that this information exists, that it is valid, that it is published in a peer-reviewed journal, and that you deserve to bring it to your doctor's attention and have an informed conversation about your risk. I want you to walk away from this video feeling empowered, not frightened, because that is exactly what this knowledge is for. You are not powerless here. If you are on any of the medications we covered today and experiencing nerve symptoms, You now have specific research-based information to bring to your next appointment. You can ask the right questions. You can request the right tests. You can advocate for yourself in a way that changes your outcome. There are two protective steps I encourage everyone to consider. First, if you're taking metformin, diuretics, or any of the medications discussed today, ask your doctor about adding the appropriate nutritional support. Methylcobalamin for B12, a quality mineral supplement if you are on diuretics, and acetyl L-carnitine as a broader nerve protective agent, which has been shown to defend nerves against toxic damage from multiple sources, not just chemotherapy. Links for these are in the description below. Second, consider working with a functional medicine practitioner who can look at your full picture, your medications, your nutrition, your lab results, and help you address root causes rather than simply managing symptoms with additional drugs. I will leave a link below to help you find one in your area. If this video helped you understand something you have been confused or worried about, please share it with someone you love who might need this information too. Drop a comment below and tell me which of these 6 categories surprised you most. I read every single one, and if you have not subscribed yet, please do. I am here every week with honest, practical health guidance for people over 60. Take good care of yourself. You deserve to feel well. I am Dr. Ryan Mitchell, and I will see you in the next